It is important to understand the role of androgens in cardiovascular health and well-being before dwelling into the pathophysiology of ADT and its effect on cardiovascular risk. So as it turns out that androgens have a significant cardioprotective effect. In the 1990s, there were a multitude of studies that looked at the role of androgens as coronary vasodilators. So if you injected intracoronary testosterone, it led to coronary vasodilatation. In men with established coronary artery disease, testosterone, when given, prolongs the time to ischemic ST depression on treadmill testing. Furthermore, testosterone helps with plaque stabilization by inhibiting platelet aggregation and promoting fibrinolysis and clot degradation. As we all know, testosterone also has favorable effects on body composition. It helps improve and increase lean body weight, meaning it helps to gain muscle mass, which also improves insulin sensitivity. Last but not the least, we know studies have shown that men have shorter QT interval as compared to women. In an NHANES study of greater than 700 participants, the higher the testosterone level, the shorter the QT interval. Now, even though we don't know the clinical ramifications of this finding, we do know that prolonged QT is antiarrhythmic. So we can speculate that shorter QT intervals probably lend antiarrhythmic properties. As we can almost assume, and as we already know, that there's a lot of shared risk factors between prostate cancer and cardiovascular disease by virtue of risk factors as well as age, as well as the demographic. So, and in addition to that, some of the therapies, including androgen deprivation that is used for prostate cancer, often tend to have cardiotoxic effects. We'll talk about that a little bit more in the future. But because of all those reasons, it is not surprising that cardiovascular mortality is a big cause of mortality in patients with prostate cancer. And most studies have shown that it trails prostate cancer mortality by only a little bit. So it's a significant amount of patients with prostate cancer that actually die of cardiovascular reasons, not of prostate cancer itself.